Alright, so today we're going to be doing the cervical, spine, and neck evaluation. So first we want to test for ABCs. We're going to check their airways, if they're able to talk, breathing, make sure they're breathing properly, and circulation if they need any CPR. Next we'll go over history, so do the past history and the present history. And then we'll inspect for any swelling, discoloration, deformity. So for the palpation, we'll start with bony palpation. This is to check for any fractures or subluxation. So go to the spinous process, down over here, C7 vertebrae. Then we'll look for, we'll check the transverse processes. So we should see that over here, lateral to the spinous processes. Then you want to palpate the occiput. So keep your head straight, strong, please. There you go. All right, and then next we want to palpate for any soft. We want to palpate the soft tissue, so we'll want to palpate the trapezius muscles. So down here, going over here. This is to check for any strains or contracture. Then we're gonna go through the paravertebral extensor muscles. So this is just the extensor muscles here. Muscles here, and then. Next for the scalene, so do you mind just looking this way? Alright, so you want to go like this for me? So basically it's going to be the muscles side here, and palpate those. And then we're going to check for any strains, contractures again. The sternocleidomastoid muscles be right over here, and then we want to check the cartilage for any enlargement. Check that, and then we want to check the lymph nodes for any enlargement as well. Check that. Okay. So here we would usually go through special tests, but we're going to skip that for now. Then we just want to do range of motion tests. So we're going to do this actively and passively. So we're going to start with flexion. So go ahead and look down. And then go ahead for extension, look all the way up. And then for rotation, so you just want to rotate your to the left. And look back up here, and then rotate to the right. And straight again. Then you want to do lateral bending. So you want to ears to the shoulders basically, so lateral bend to the left, lateral bend to the right. There you go. All right, and then next we're gonna do strength tests. So we're gonna do this in restricted range of motion basically. So for flexion, basically you want to stop them from using their core. So keep your shoulder here, and we're gonna press up against their forehead, and they're just gonna basically use your neck to flex. Chest to strength. So go ahead and go forward. And you could do it repeatedly, so go ahead and do it again. Forward. You could just ask the patient to do it again if you need to. Next, we're going to do extension. So you can go back. So we're going to press up against my hand. So back, look up. Cool. Do it again. Up again. You can do that again repeatedly, or you're going to look all the way down again, flex all the way down. And then you just want to add pressure and have them look all the way up. So go ahead and look up, and go. And then next, you want to do, flexion. So that tests the sternocleidomastoid in the anterior scalene. An extension, the cervical, paraspinals, trapezius, and levator scapulae. Next, we're going to do rotation. So you're just going to look left and right with restricted range of motion, of course. So it's going to work on the contralateral, sternocleidomastoid, and the trapezius. So go ahead and rotate, and then rotate towards me. Good. Cool. And then lateral bending, so this is just for the ipsilateral scalenes, the sternocleidomastoid, and the paraspinals. So I'm gonna press here, and you're gonna laterally bend left and right, okay? So again, push, 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 push. And the same here. Push, 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 push. Alright. And then from there, we would just do lateral neurological tests, going through motor, sensory reflexes, and we'll go blood flow tests.